Okay, thank you for your first part of the interview, and we discuss your background in the business, in medicine, in cardiology, and your thoughts on the heart attack problem from different point of view. And we finish the previous part on the point that in the future, you're assuming that it will be shift from in terms of age, and more people in young ages, they will have a problem by different factors, independent factors, smoking, stress, and other things. And did I get you right that, for example, if right now business started invest their resources in motivate or maybe to work with the young people, it will be very, very good from strategic point of view, because in 10 years, they will be more prepared for the heart attack problem and other heart disease, right?
Yeah, so I think in terms of asking where I thought things would go with heart attacks, certainly as the population gets older, you'll still see a lot more heart attacks in older people because they survive longer. But I think, where that'll always be the case. And obviously there'll be different numbers of people who get older, but I think you'll see heart attacks at a younger age is what we've mentioned. I think from a business point of view, there is a big challenge. So in this part of the world, as I said, because your health insurance is not paid for by your companies don't value your health as much as you think they should. And in fact, the responsibility is down to the individual. In the US, some of the companies, because they pay your insurance, want value for that, and therefore they offer you programs, a bit like the diabetes prevention program I mentioned about with Fruit Street. But the challenge, therefore, is trying to personalize healthcare offerings to your staff in a way that they actually, as either an employer, get a return for that, and what that return should be. So, I mean, that if you stay healthy, if you stay well, that you will be able to work, you won't go missing from work, you'll be more productive. And if you're more productive, the company should make more money. I think the other situation is that if you operate from being a very healthy company and you're very authentic to that, and everybody buys into that, you'll be a better group of people working together. But unfortunately, when people go in these programs, they still eat the wrong food in the canteen. They still go out the back of the company and go for a cigarette. They still get in the car. They don't walk home or whatever it might be. And so therefore, it's not as completely authentic as it should be. And in truth, people aren't kind of showing up in the way that that represents real integrity behind looking after health. So that's a real problem. And I think that business hasn't bought into that, because business is all about the bottom line and doesn't see how important health is. I think one of the interesting things about health as well, even with heart attack health, is the massive interest that there is in the world at the moment around sustainability. And health is actually sustainability, because your sustainability, be it about the beautiful sunset you have there behind the Golden Gate Bridge there in San Francisco, or where you have nice trees and where you have the sun and where you have fresh water, they're all your basic health requirements. Your diet controls your health risk and your risk of a heart attack. The fact that you get out for a walk in the fresh air improves your mental health and your physical health. Drinking plenty of water is good for your health. So all of those aspects of sustainability are your health. So a lot of businesses are very interested in the whole aspect of sustainability. The World Health Organization has put out a number of different initiatives or guidelines of what they would like the rest of the world to do in terms of sustainability goals, one of which actually includes the health and well-being of people. So the irony is that if you were to look after heart health as an example, as the well-being of your employees, then perhaps you're driving your sustainability goal in a way that improves their health, and that also improves the health of the population, be it of San Francisco or wherever your company is based. And it also does something for the environment, because everybody else is much more in touch and much more engaged in a very positive way. And you will see that by doing that that all those other measures increase your bottom line, and they also improve the performance of your company. So it's been a huge challenge, because most companies don't want to be responsible for every problem that their employee has. And I think also one of the challenges is to get the right group of people, like the right group of doctors involved, who actually strategize that you actually align what you're trying to achieve for individuals. So, I mean, if you're the overweight individual, well, then perhaps you need to be lesser weight because you're carrying blood pressure or diabetes. I'm not saying every overweight person needs to lose weight. I'm just suggesting if you're trying to impact on heart health, say the CEO's had a heart attack, well, then the CEO should show up and try and get everybody in the organization to reduce their risk of having a heart attack or any risk for heart disease, and should do everything possible by getting the staff to take a break and go for a walk, by getting the staff not to eat too many treats and sweets, by getting rid of the soda drinks out of the coolers in work and replacing them by water. So, I mean, most companies don't do that. So, and I think that of itself is a huge opportunity. And I think the heart attack space, as you mentioned, because of the high mortality, i.e. people die from heart attacks, is one of those very low hanging fruit where there's a huge opportunity. And one of the things I'd add, Alex, is that the risk factors that cause heart disease also cause cancer. So if you know nothing about heart attacks, you know something about cancer. It's the exact same reasons that you get the two of them.
And
so
you can catch two diseases, right?
Yeah, absolutely. Absolutely.
Interesting. And you touched this very interesting topic when the business, what will be the motivation for the business to work in this direction of reducing heart attack? Because if the company will be involved in this, they will have more healthy employees, and they will have less problem or maybe less cost from insurance point of view. And try to imagine that today business companies go to the insurance company and say, hey, we are maybe, I don't know, private practice of Dr. Robert Kelly, and we can really reduce heart attack risk score of your patients, of your clients in which have your insurance. And this will reduce your risks, and this will potentially reduce your cost of covering this risk. And the obvious obvious thing that insurance company will be happy to collaborate with Robert Kelly right now, with the company. But something said for me that they don't do this. And what do you think? Why they don't do this? Because from logical point of view, it's obvious, but maybe by some reasons this not happened.
I suppose the answer is it depends on what business model you have.
Business model, let's try to imagine you advise them, for example.
No. I mean, the insurance company's business model for the insurance company may or may not depend on how healthy or how many people are alive. And the business model for the employer may also be in how much the turnover is versus how many people are required to actually make the turnover happen. And I know that might sound very cynical and very unfortunate, but that's the reality of it. If you saw a broader picture that the health of your employees contributed to something more as part of the way your organization was actually structured and the culture of your organization was, well, then I can guarantee you'll find that the most successful companies in the world are those people who value those things. So I think that speaks to itself, but I know that at the end of the day, if you have big payouts from insurance companies for chronic illnesses, well, then those employees become a liability for you. And if you're stuck in the same situation where your employees are off sick all the time, that's an issue to you. So if I were that person, as you said, my company were trying to engage with insurance companies or employers, I think you need leadership from a senior physician. And I think you need to educate the staff in terms of, say, as you talk about the heart attack risks. And I think you also need to get buy-in from the senior management. They all have to buy into that. And it has to be seen. So people have to be getting up and moving around the office. People have to be going out for a walk. They have to be eating the right stuff. And they have to be practicing what they preach, because you can't have, you can cheat this out, but you have to have the community, people in San Francisco buying into the fact that your health is important, and you have to buy into the fact that getting out on your bike, and you have to do all these things. So it's an opportunity for businesses actually to lead an impact in health, that they care a lot about it. And businesses hugely influence insurance companies depending on their size, and vice versa. So, I mean, I think that it's just about getting stuff into the patient, and it's about getting the patient to follow instructions, and it's about supervising. And a lot of people don't want to do that, particularly when you're there to go in and do your IT job or whatever other job it is. They're not there to mother you. So, there's got to be the business model of kind of healthcare for the person who's the employee has got to have some return beyond their health in the eyes of the way the system is currently set up.
Got it. Got it. Thank you for this explanation. And continue this conversation about the business and business model and other aspects. What do you think? How does technology help, or maybe don't help, with the heart attack problems? Actually, as I realized, there are two big area. One, it's to fix problem when it happens, right? And from this point of view, I'm sure that we have a very nice technology, very nice all medical equipment and other things. And another area, this is how technology help to prevent in the early ages, in the early stages of the illness, to all of this. What are your thoughts on this technology input to this problem? Yeah.
I mentioned in the first half about being involved in the statewide implementation program for heart attack management in North Carolina, which I was involved in between UNC and Duke University. What was really impressive at the time is that there were parts of North Carolina that did not have any basic technology, this was 15 years ago. So you could end up in a hospital with no ECG equipment, which is the electrodes that you use to diagnose a heart attack. And so ultimately what solved this system, and was very evident in other parts of the US, was having a very strong connection between different hospitals or different clinics, centralized to places where you could be flown in, driven in, or whatever, to have your heart attack treated, that the people were there and there were processes in place. And what makes a difference when you have a heart attack is you get to hospital really quickly, because you can have a procedure done that takes the clot or the blockage away and solves your problem. You have a stent put in or whatever. That's what saves your life. Nothing else saves your life. Now, the one thing is if you drop dead, the other thing that saves your life. So if you collapse in the office and you're not breathing, having your staff know how to resuscitate you is critical. So you can save a life if you have the defibrillator on the wall, you pull it down, you follow the instructions, you start resuscitating your colleague. That will save a life if you get them early enough. Not in all cases, but in a lot of cases, and actually getting them shocked. So there's really clear guidance about that. There's very clear guidance about how to use those machines. That technology is in place. It's in place everywhere, and you would hope it's in most of the offices and the companies you refer to. So having people engaged in how you resuscitate, how you perform first aid, is an opportunity to get them more engaged in other aspects of health beyond that kind of rare event, depending where you work. Having the systems in place within the state you're in, or in the district you're in, or where you are, to get people quick access to emergency treatment. And bear in mind that your employees are covered for the place they need to get to, because sometimes the insurance models don't cover you for every health facility in the area. But as I said already, if you get people to be more healthy and choose the behaviors that reduce the risk or prevent them having a heart attack, well, maybe the technology needs to be served around measuring and monitoring and giving information and showing people how to change, and helping people, more and more people kind of learning from it and doing something about it. And that's where a lot of the technology is at the moment, and a lot of it's in wearables and a lot of it's in other monitoring devices. But the problem is it's not aligned with anything. It's kind of, you can wear your watch and say, aren't I great, I do my 10,000 steps every day, but I have no idea what my blood pressure is, and I know my waist circumference and my body mass is this, and I know I have a couple of other things, but I can still do 10,000 steps a day. So it really just, it doesn't bring it all together. So it's kind of, in the heart attack world, if you want to stop the heart attacks or impact them, that's where you need to be. The other systems need to be in place. A lot of that's set up by medical health systems, or at least it should be set up by medical health systems. But connecting people is an opportunity, because through connection, you share information. And even if you connect your employees together, so more of them buy into health, and the group becomes bigger, I think connecting you into the system that is the hospital or the heart attack center, or if it's connection into exercise programs or gyms, or wherever it may be, food suppliers, food markets, that sharing of information goes a long, easy way for people to dip into that in whatever way they want to, and also to support that. And I think also the other thing is, if you get involved, most companies try to be charitable to local initiatives in their cities. If you support things like access to heart attack care, then you take a much greater interest as a bunch of employees to support heart attack care. So I think there's loads of different avenues and loads of different ways for the more creative amongst the companies to leverage aspects of technology to get more involved and more engaged with what is. And I think for a lot of people, in truth, Alex, it's the same in this part of the world, is people care about their friends and their family. And so ultimately, maybe the solution of connection is around your family. Maybe it is about being able to take a call from mom or dad, or if something pops up on the phone that something's urgent, and that you can press a button and direct mom and dad, and you can still do your job. And maybe you feel like you're contributing that way. Ironically, I think, my belief is that the most simplest things in life are the best solutions. You can see that most of the technology out there that really works. So it's really about understanding, at the heart attack problem is very much a local need to understand as to how it's delivered. But, I think that the more that people kind of get engaged, the more they share information, I think that's where technology has an opportunity, to help you get healthier, to help you get access to heart attack treatment, or to help your family get access to heart attack treatment. So, it's everybody, all hands in. And that's what you want as a business. You want your staff all hands in, working together on, the projects that you do in companies. So your health should be part of a project, just like other projects you have within that. So that whole sort of way of driving the culture will drive the way that you have a better heart attack rating. And I think, the one final thing I'd say about the question is, perhaps there's an opportunity, where you have the healthiest companies in America, so that there's a kind of an Oscars type ceremony as it relates to your part of the world, where the Oscar goes to this company because they score the highest in terms of the corporate health program they've done. But perhaps there's a heart attack Oscar. Perhaps there's a heart attack Oscar for the company that has the least amount of heart attacks, plus is the greatest support of the local heart attack network or initiative, has the most amount of staff that are engaged in preventative health measures, and there's some kind of payment for that, and it's supported by the Heart Association or whoever. And perhaps that's a way to recognize kind of heart attack management from a corporate space. And, corporations love that. So,
yeah, it's an incredible idea about Oscar. And in my head, it was like, a world championship between countries, which country provide better, conditions and other things related to the decreasing heart attack in their country. It's awesome idea. And continue of the technology thing. My question is about artificial intelligence. Everyone talk about artificial intelligence and how this will be good or not good. Some scared about artificial intelligence. What is your opinion on the artificial intelligence? How this help to prevent heart attack? How this help to sharing information and how you said to have access for the our parents, our brothers, sisters, that they have access to this simple guidance how to exclude yourself from heart attack. What do you think about this?
So my insight in artificial intelligence is a little bit limited, but the company that I'm the medical officer or chief medical officer for in Switzerland have an artificial intelligence backed platform for identifying people with rheumatoid arthritis having disease deterioration. So it's interesting to use that information to take the clinical data or the research data and put the artificial intelligence algorithm behind it. And so there's vast amounts of heart attack data that's in the US around managing patients with heart attacks, where the algorithms can be used for predicting risk so that you could apply them at home to identify certain risk scores. There's plenty of data around using the algorithms in terms of treatment and in terms of all the measures we spoke about, even measures like an artificial intelligence to pick out what food is good for you and what food is bad for you based on the shop you go into. Even an artificial intelligence algorithm that would pick places that are good to walk for, the pace you need to walk at to get the most benefit and what benefits you're actually getting. Even artificial intelligence programs around, the benefits of the more healthier, ergonomically friendly or going up and down the stairs type of initiatives. So there's a lot in that. I think some of the dangers in artificial intelligence is for patients to trust the technology. And also because you may have a lot of people who will get alerted to problems that they don't necessarily have. But that's part of the learning. It's like everything with any technology, it comes to that way. And I think that I think it's important as well not to dehumanize healthcare. I think it's people you're dealing with. I think it's important that people are involved and that you don't let the technology take the place of the people. But again, I think that's also part of the learning. I think when you bring the artificial intelligence and technology in tandem with the doctor, I think people will get that more easily than if you try and put the technology on the patient's lap and step away as the doctor. And I think there is, I think that aspect, there's a generation that love their iPhones and love their watches and love their Fitbits and love all their Oura rings and whatever you want. They love those, but they don't use it for health. They use it for a bit of performance. They look, I sleep better, and maybe I don't need to go to bed as late, or, maybe I eat less sugar, but these things, you shouldn't do them anyway. A lot of athletes use them, but it's not about their health. It's about their performance. So, that's only, say, a tenth of the population. You're trying to deal with 90% of the population. You're trying to deal with a bunch of the patient population I said are all stressed out. That's not the athletes. So, you have a huge group of the population that you're trying to target. But, again, as I said about integrity and authenticity, where a lot of the tech companies are trying to get into health, it's not about the gadget. It's about what you believe in health. I had a conversation with somebody actually yesterday from the US about the same topic, and saying, well, what do you mean, Robert, by being authentic? And I mean, health is everything. It's where I come from, health. I believe, yes, you could wear a wearable that might be telling you could be having a heart attack, but you got to believe that I believe that my health is important and that the technology is there to help it. It's not about you give everybody in your office an Apple Watch. It's not about that. It's about you promote the heart attack, and maybe the Apple Watch is there as something to facilitate something, or the Fitbit, or whatever it might be. So I just think that's important, because I think based on the conversation we've had, people will just see these as gadgets, and they won't get any value out of what people are trying to actually achieve, to actually make the whole system better, and to make the care better, and to make the awareness better.
Yeah, I remember how one of the physicians from the medical health cardiology center shared with me an interesting story when he had exercises with a patient, right? And after that, he encouraged a patient to walk more, and probably, use the 30 minutes walk before exercises. And yes, patients called to the physician and said, try to imagine I have a walk before exercises, but physician hear that he's doing with a smoking cigarette. And it's what you said. For sure, all your company could have an Apple Watch on, but it doesn't mean that all of them will be healthy.
And it's not, if you want to say measure performance and say, well, here's a measure of how healthy we are as a company, that 10,000 employees have an Apple Watch. That's absolute nonsense. It means absolutely nothing to do with health. If you have 10,000 people, you're documenting 10,000 steps with no cigarettes in your mouth, well, maybe that's a different proposition. But it's, so it's, I think that it's all about aligning things. I think one of the interesting things with artificial intelligence, as you mentioned, is that the intelligence comes from, say, the mind of a doctor or a bunch of X-rays. And my reading of an X-ray, it doesn't come from some third-party being that suddenly creates a new way of reading X-rays. It's an algorithm based on a human kind of assessment. So, but one has to accept that the challenges in healthcare, such as the shortage of the human resource, is going to disrupt the system where technology will get in there. The question is, will it succeed much better by having people like me who actually believe in both as a way of doing it, rather than being forced on people where you'll still see them, as you say, smoking the cigarette, counting the steps, and walking down the road. So it's, I think that is, again, trying to get people to buy into health as an important part of their life, as opposed to just buying themselves the brand new gadget of the time, because a little button might tell you you're having a heart attack.
Yeah, and my next question in this artificial intelligence area, what do you think? Is it possible that maybe in 10 and 20 years, artificial intelligence will be so powerful that it will be not necessary to invest time in education of the cardiologist, and other maybe doctors will not need it? What do you think about this? I'm sure that it's a provocative or not the case, but anyway, I'm curious about your thoughts on this.
Well, so one of the interesting things around this is, obviously the answer is no, because I'm a human, and obviously unless I own a big artificial intelligence company and it's more in my interest to see it work than me, well, that's a different answer. But there's a lot of artificial intelligence platforms at the moment in healthcare that are doing things like managing, taking the data from patients' heart rhythm recordings that are done, say, when they're in the home. And they're taking all the data and they're using the data to predict cardiac events, which is great. But the reality is that most people don't use those devices anyway in the first place. So they're using artificial intelligence to try and drive a business model that actually isn't being used in clinical care. And so next thing is that, something that you maybe should be measuring, but you never did measure, is now available because it's stuck on your whatever gadget you have, and it's backed by artificial intelligence. So it makes it nice and easy to do it. I think the step in that is much more about, can you pick up other markers that are clinically relevant and use the artificial intelligence around that? I mean, I have no doubt that things like predicting breast cancer on plain x-rays is a fantastic artificial intelligence endeavor. I have no doubt for the data that's in all those x-rays, but how many more x-rays, how much more radiation do you have to give people so that an artificial intelligence data is more effective? And I think that there's a lot of data issues around sharing data and how artificial intelligence can be done effectively without exasperating certain people politically and otherwise to actually work against it, which is very unfortunate. And I think in the heart attack space, there's still very much a human involvement. There's a lot of stuff around cardiac CT that would be invaluable with artificial intelligence. But even when you look at a cardiac CT as a doctor, it's not completely accurate. It's not 100% accurate. So again, you're using algorithms that are based off something that's 80% right, as opposed to 100% right. And so, it's never going to be perfect enough. And as long as it's never perfect enough, you're not going to replace the human. And finally, I don't think people will let you replace the human.
Yeah, I absolutely agree. And I remember some thoughts from PMP area project management certification that you can use some agile and other fashion technology, but when we are talking about lives of the people, it doesn't work. You should follow the traditional approach when you provide all the details, requirements, and procedures, and all things traditional project management, and it's how it works, and with the risk management and the other things. Okay, and I believe that it will be my maybe last question today. And point, you mentioned about telemedicine, that 10 years ago, it was not the time for this interesting thing. What do you think about right now, after the COVID? What the place of the telemedicine right now, and what the future of the telemedicine from your perspective? What do you think?
So when I was involved in telemedicine about 10 years ago, I was working for a company. I was approached literally after I did my MBA to know, would I help a company launch into the primary care market with a telemedicine platform, which is very like sort of your FaceTime or something of that nature. And the owner of the company and the kind of CEO of the company had no healthcare expertise whatsoever. So that was already a problem, but they brought me in with the idea of designing the content, the type of interactions, the type of patient groups you could engage with. And at that time, the only telemedicine companies of the world in this part of the world, there was one in the US that we went to visit who were doing a lot of urgent care telemedicine. And we had engaged with that company, and that company were really, really struggling to get people to buy into telemedicine. They felt that, a bit like the artificial intelligence conversation, that it was machines, that you were losing some value in the conversation, that there was a risk that if somebody was really sick, you wouldn't pick it up on a screen. And there were all these other things. So there was a lot of efforts to make telemedicine fail. A lot of it was just the patient. It wasn't, again, engaged with by really bringing the patient in. And then more recently, because of data, you couldn't just use your FaceTime or a video on your phone, even though most people do that anyway. And there's a lot of regulation around it, et cetera, et cetera. And the higher the regulation goes, the more expensive the technology has to become. However, some people got very clever at that time. They went into other poorer countries. They set up telemedicine programs. They found it worked. They learned how to scale it. And some of those companies today are extraordinarily successful. But the other clever thing behind telemedicine, which I always realized from the outset, was to put a disease into telemedicine. So the diabetes program with Fruit Street is a telemedicine platform. You've got a coach there. You sign up, you share your weight, you share your wearable data, and the coach coaches you through how you're getting on, and you go through a program of goals, and you have a place to go and look for information through a website or a platform. And the same is true of a lot of other telemedicine platforms that are in the US. Now, bring in COVID. What COVID has leveraged off telemedicine is access that you couldn't get before, because there's millions of people trying to get access to a doctor. Whereas before there might be a couple of thousand people trying to get access. So there's also that safety of patients. You don't want to be coughing all over the doctor and every other patient and giving them COVID. So you can stay at home, you can use the telemedicine, you can engage with the doctor. And it's very acceptable to do that. And all the legislation in the US has changed as a consequence of that to allow telemedicine both across states, because every single state in the US has a different legislative rule for how telemedicine is conducted. So if you're a doctor in the state of California, you cannot give telemedicine coaching to somebody on the East Coast of America because it's not allowed unless you're licensed in that state as well. So telemedicine is definitely of its day. It's definitely a more effective and more cost affordable way to deliver care, but it's most effective where you have the patient engaged and you offer them more interventions. Ferrucci got involved in COVID as well for exactly the same reason. It doesn't, you'd have coaching or you'd have access to GPs or to doctors as a way to deliver a service online. Like everybody's using Zoom as a consequence of the last 2 years. So everybody's remotely working. And I think there is a change element. If you're an older person, you may not like technology as much as if you're a younger person. And so there is a tidal kind of wave that will come where all the 20-year-olds of this time will be 70, but their 50 years of life will be on the crest of all the disruptive technology companies, where their grandparents will have come to a stage where Apple only appeared in the last 10 years and Google and Facebook and everybody else. And so the technology momentum will pick up over a period of time. So, and people want convenience and people will trust it when they get the doctor that way. There are privacy issues around that. A lot of people, because of convenience, because of ease of access, will use telemedicine in that way to access care. In my country, the problem is how it's paid for. Some people in Ireland think you should get everything for nothing. The government aren't paying the doctors, so the doctors won't make the time. And when you don't have a lot of doctors to do the telemedicine and you don't have the nurses, who's going to do the telemedicine? And so again, what happens is because people aren't getting paid for what they're doing, you find barriers start to appear all over the place to block what's a really, really useful piece of technology. So, I use telemedicine. I use a lot of FaceTime. I use some patients in my country, which is very interesting during COVID, is some of my patients like the old traditional telephone, because in their house, the old man can use the telephone and his wife can use the telephone in another room and they can hear what the doctor is saying to it. Whereas if they're on the technology, they get so kind of caught out by the raspberry, whatever's going on with the technology, that they completely miss out on the conversation. But the other thing is when you're with a patient as a doctor is that you hugely appreciate the patient's body language. You hugely appreciate the patient's eye movements, the tone of their voice. You don't get that as well when you're on telemedicine. And most of the telemedicine companies, certainly the ones I've worked with and the ones through the US, all have very strict, guidance to make people aware that if you're having something like a heart attack, the telemedicine platform is not the place that you should be on. You should have called 911, or in our country, it's 112 to alert the ambulance, because that's what you should be doing. So it's, I think the technology is there to help people. I think it's hugely useful to help people. I think telemedicine offers an enormous complement to a lot of other branches of healthcare. And I really, really think it's a very useful, valuable way of delivering part of care, not instead of, and not all of care. But I mean, if you're in the office and somebody's not well and you want to talk to a doctor, if there's a way to get through a telemedicine platform that people can access, that is an arrangement. If it's kind of you're one of those heart attack kind of businesses that have taken that interest, well, then having that kind of access and that point of access is useful, but it just has to be created in a way that's probably staffed by a nurse and not a doctor, because you won't get a doctor who's available that time all the time. So, I think the technology is to be welcome. And I think other people, stakeholders like political stakeholders and other stakeholders, need to identify that this is serious. This is not just a gadget with no backing to it. And I think that's, you get rid of all that type of bureaucracy and see the value that it has for delivering care.
Thank you, Dr. Robert. This is a very positive thoughts on telemedicine. I'm sure that it's a wrong thought to think that this will be, telemedicine will be instead of the traditional medicine, but as the part of the whole system, this is a very, very, very beneficial for everyone, the doctors, for the patients, for the system.
But even for delivering all the prevention, even for coaching people around weight, even for helping people exercise, even when you have your phone and you can interact with somebody, even for having your doctor's visit, even for doing your medical, all of those things can be done in the convenience of holding your phone in your hand. and can be followed up and aligned with other things you have to do. So, I mean, I think the point about it is it connects everybody. So it's again, it's about integrating it. Again, it's about having human interaction. Again, it's about getting the system right.
Yeah. Thank you so much for this very super interesting conversation, Dr. Robert. I'm sure that you have enormous thoughts and ideas and practice and knowledge accordingly all aspects. I'm sure that in the future we will probably make one more series about different aspects of the heart disease problem, or maybe other things, business point of view, whatever. Huge thank you, much appreciated for all your energy and your spirit, that for your encouragement for our volunteers, for the regular people, and for sure for the business who will be involved in some kind of process to make this happen, that to reduce mortality rate and to make people more healthy, not the formal or I don't know fake statement when you have gadgets or something, but you have real health and you follow some simple process without very efficient, without bureaucracy and other aspects which make it a bit difficult to do it right now. Very good. Thank you so much, Dr. Robert. Thank you.
Thank you, Alex.
And I'm sure that we will have one more series, and thank you for your time, and thank you that you found in your very hard-loaded schedule window for us. Thank you so much, and see you soon, Dr. Robert. Thank you.
Yes, thank you very much.
Thank you. Bye-bye.
Bye.